What does it mean to end the AIDS epidemic by 2030? Vietnam chose the theme for the National Action Month for HIV/AIDS Prevention and Control in 2024 as Fairness and Equality in Access to HIV/AIDS Prevention and Control Services towards ending the AIDS epidemic by 2030. In recent years, although Vietnam has implemented many harm reduction interventions, the HIV epidemic is still complicated and tends to increase among young adolescents and men who have sex with men, MSM. These are hidden populations, so it is very difficult to approach and implement necessary interventions. Moreover, the risk behaviors of this group are very complicated, such as using synthetic drugs, using chemsex, having group sex, etc. Stigma and discrimination against people living with HIV and low levels of knowledge about HIV/AIDS in the community have been and are barriers to accessing HIV/AIDS prevention and control services for both people living with HIV and high-risk groups. Financial and geographic barriers also limit access to services for high-risk groups. Many people in high-risk groups often have low incomes and cannot afford healthcare services. At the same time, transportation and geographic distance are also obstacles for people living in rural, remote and isolated areas. Towards ending the AIDS epidemic does not mean there are no more people infected with HIV, no more people dying from AIDS. But it means when AIDS is no longer a worrying health problem in the community. Towards ending the AIDS epidemic does not mean there are no more people infected with HIV, no more people dying from AIDS, but it means when AIDS is no longer a worrying health problem in the community. The financial resources for HIV/AIDS prevention and control programs still depend nearly 50% on international projects, especially for key prevention programs. Pre-exposure prophylaxis PrEP is completely dependent on aid projects. Currently, the Health Insurance Fund and the state budget do not have a basis to pay for this intervention service. In addition, the process of transferring finances for HIV/AIDS prevention and control in the near future is still facing many difficulties. Especially in the context of a rapid and strong aid cut roadmap, the goal of ending the AIDS epidemic, Resolution number 20NQ/TW dated October 25, 2017 of the Central Executive Committee on Strengthening the Protection, Care and Improvement of People's Health, has set the goal that by 2030 Vietnam will basically end the AIDS epidemic. Fairness and equality in access to HIV/AIDS prevention and control services. Fairness and equality in access to HIV/AIDS prevention and control services. Read. Now, accordingly, on August 14, 2020, the Prime Minister approved the National Strategy for AIDS Prevention and Control by 2030. This is an urgent requirement to ensure full and timely concretization of the party's policies and guidelines on HIV/AIDS prevention and control, and to be consistent with the new situation. The Secretariat also issued Directive Number 07/CT/TW dated July 6, 2021 focusing on strengthening leadership in HIV/AIDS prevention and control in Vietnam with the goal of ending the AIDS epidemic before 2030. Towards ending the AIDS epidemic does not mean there are no more people infected with HIV, no more people dying from AIDS, but it means when AIDS is no longer a worrying health problem in the community.